Anna.
Hi.
Hi, my name's Jake. I'm going to be your physician assistant student today. How are you?
Good. How are you?
All right. So what brings you in today?
So for the past 4 to 5 days, I've been feeling a pain in my groin area.
Mm-hmm.
Yeah, it's just been very uncomfortable. It hasn't been interfering with a lot, but I just want to come and get it checked out.
Okay. And can you show me where exactly it is?
So it's just my inner thigh, just on my left side.
On your left side?
Yeah.
All right. And when did this happen?
I've noticed it 4 to 5 days ago, I would say.
4 to 5 days ago?
Yeah, sometime on the weekend. The pain has definitely been getting worse.
Mm-hmm.
But, yeah.
All right. And was this sudden or gradual?
I know I felt a little bit of discomfort for a while, but it was
Mm-hmm.
never pain. But then over the weekend I was gardening with my husband, and I bent down to pick up a bag of mulch, and it was a sharp pain. And then since then it's kind of just gotten a little worse and worse.
All right. When did this discomfort start, if you remember?
I would say probably maybe a week or 2 weeks ago.
A week or two ago?
Yeah. But it hasn't been anything it wasn't severe discomfort or anything.
Okay. And this has been going on for four to 5 days now?
Yeah, the actual pain.
Okay. Is there anything that makes it worse or any better?
Not really. I've tried to take a warm bath,
Mm-hmm.
and that kind of relieves the pain.
Does it?
Sometimes when I lie down,
Okay.
it doesn't really go away, but it definitely lessens a little bit.
All right. Is there anything that makes it worse or any better?
I haven't really taken anything for it, but when I do go to the bathroom, it definitely feels a lot worse.
And has it been getting worse since that initial pain that you felt?
Yeah, definitely.
And has this happened before at all? And
No, I've never.
no? How would you describe the pain? Shooting, dull?
It was kind of a dull pain, but then when I bent down over the weekend and grabbed the bag of mulch, that was definitely a sharp pain.
Does the pain radiate anywhere?
No, it's really just in my inner thigh, my pelvic area. Yeah.
All right. On a scale of 1 to 10, 1 being pretty much no pain and 10 being the worst pain that you've ever felt, how would you rate it?
I would say it's probably around a 6.
A 6?
Yeah.
All right. And is there any certain time of day that it's worse, like in the morning, when you're moving throughout the day, or at night?
I've noticed that it hurts a lot throughout the day, especially if I've been walking a lot.
Mm-hmm.
I'm a teacher, so I stand up a lot during class, and I've noticed that kind of definitely gets worse.
Okay.
But when I lay down at night, it definitely relieves a little
It
bit.
relieves it?
Yeah.
Okay. And do you have any other symptoms that came from it at all?
I have noticed that I've been a little nauseous.
Nauseous?
Yeah, I haven't vomited at all, but just a little feeling of nausea.
Okay. All right. So I just have a couple of general questions for you. How old are you?
I'm 47.
47. And are you Asian?
Uh-huh.
Yeah. Just wanted to make sure.
Uh-huh.
You said that you're a teacher. What grade do you teach?
3rd grade.
And prior to this incident, would you say that you were in good overall health, poor?
Yeah, I mean, just the occasional cold every once in a while, but nothing serious.
Okay. And you said that you and your husband, so
Yeah,
you're married?
Yep.
And you said that you haven't had this before, any injuries to your upper leg at all in the past?
No. Never.
No. Okay. All right, I'm going to ask you a couple questions about your health that you have now. Do you take any medications at all?
No, just supplements.
Supplements?
Mhm.
Do you know what they are?
Just multivitamins, calcium. That's about it.
Do you know the dosage of these at all?
No, I don't.
No.
Just take them
How often do you take them?
every day.
Once a day?
Yeah.
And by mouth?
Yes.
Yeah. And are they pills, chewables?
They're chewable.
Chewables? Do you have any allergies to any medications, any foods, insects?
No. I occasionally have seasonal allergies, but
Seasonal?
nothing besides that.
Right. And what type of reaction do you get from that?
Just the stuff with congestion.
Congestion.
Nose, yeah.
And has this happened recently?
No, it's more a lot worse in the springtime.
In the springtime?
Yeah.
Right. And you don't have a latex allergy?
No.
Iodine?
No.
Chlorhexidine?
Mm-hmm.
All right. So have you had any like adult illnesses recently?
No.
No? Do you have any medical conditions?
No.
No. Hypertension?
No.
Diabetes?
Mm-mm.
Tuberculosis?
No.
Heart disease?
No.
Lung disease?
No.
Kidney disease?
Mm-mm.
Thyroid disease? Have you ever been tested for HIV?
Yes.
And how did that come back?
Negative.
Negative? Okay. Any seizures?
No.
History of cancer at all?
No.
Asthma?
No, I was once had bad allergies and was prescribed an inhaler, but
That was just from the allergies?
yeah, just from the allergies.
Okay. And hepatitis?
Nope.
All right. So you said that you didn't have any accidents or injuries to your leg at all. Have you had any anywhere else?
No.
No? Any hospitalizations?
Just for my 3 children.
Just for your 3 children?
Yeah.
How many times have you been pregnant overall?
3.
3? And they were all successful full
Yes.
term?
Yes.
Any premature?
No.
And how old are they?
They are 21, 18, and 16.
All right. Those are good ages. So you'll be an empty nest and they'll all be off of college.
Yeah, pretty soon.
All right. I have a couple questions about your menstrual history. When was the first time that you got your period?
I would say probably when I was around 14.
14?
Yeah.
All right. And how long does your typical cycle last?
About 3 to 4 days.
3 to 4 days. How would you describe your flow? Light, medium, heavy?
Just medium.
Medium? And when was your last menstrual cycle?
About like 3 weeks ago. Probably.
3 weeks. All right. Let's see. When was your last pap smear?
I would say about like 7 months ago.
7 months
Yeah, I
ago?
went for a routine.
Any abnormalities?
No.
No? All right. And do you have any histories of any STIs?
No.
No? Have you ever been tested?
Yes, a while
All right. So I'm just going to ask you a couple questions now about kind of specifically about the pain that you're feeling.
ago. Okay.
So we're going to start off with some general questions. Do you know what your normal usual weight is?
145.
145? Have you had any weight changes at all?
No.
Have your clothes been any looser or tighter?
No.
Any weakness?
No.
Fatigue?
No.
Fever?
No.
All right. So now, do you have any trouble swallowing with this at all? Does it go up
No.
into your stomach? Because I know you said that you had vomit or nausea.
Yeah. No, I haven't experienced any vomiting from it.
All right. Any heartburn?
No.
No? How's your appetite been since this has started?
It's been relatively normal. When I do get nauseous, I kind of just avoid eating, but it doesn't last very long. So
Okay.
I've still been eating relatively normal.
Any irregular bowel movements?
No.
No. And have there been any changes in the size or color of your stool at all?
No.
And any changes in your bowel habits?
Well, it's just painful. When
It's
I try
just
to,
painful?
Yeah. But I mean, I've been going for like regularly. There haven't really been any changes like that.
All right. Have you seen any bleeding or any tarry stools at all?
No.
Any hemorrhoids?
No.
Constipation that comes with this?
No.
Diarrhea?
Mhm.
And you said you did have abdominal pain, kind of like the nausea feeling.
Yeah.
Anything else?
No.
No. Any food intolerances at all?
No.
Have you had any excessive belching recently?
Mm-mm.
No. Excessive gas?
No.
Jaundice?
No.
No. Any trouble with your liver?
Mm-mm.
Gallbladder? No. And you've never had hepatitis?
No.
All right. Does it hurt when you have to go to the bathroom and urinate?
Not when I'm urinating. Just
No. All right. And how often do you urinate?
I would say around like 4 to 5 times a day.
4 to 5 times? All right. And nothing's changed with that? You're not going more
No.
or having the feeling to go more?
No.
No? Have you had any urgency to go in the night more since this has started?
No, not that I've noticed.
No? Any pain or burning?
Mm-mm.
No. Any blood?
No.
Have you ever had any recent urinary tract infections?
No.
No. All right. Kidney or flank pain?
No.
Any history of kidney stones?
No.
All right. And any incontinence that has come from this?
No.
No. Okay. So do you have any muscle or joint pain when you have this?
No, not really. It's
No?
just kind of like a dull pain in that area.
Any stiffness that has come from this?
No.
Any arthritis at all?
Mm-mm.
Gout?
Mm-mm.
Any backaches?
No.
No. Has there been swelling in that area?
I've noticed a little bit
A little bit
recently.
of swelling?
Yeah.
Any redness that comes from it?
No. It's just just a little swelling.
Alright. Is there, when you touch it, is it tender and painful?
Yeah.
It is?
Mhm.
Any weakness that has come from this?
Um,
Like when you try to lift things, or have you not tried to do that recently?
just when I try to lift.
Just when you try to lift things? Alright. Has this decreased the amount that you like move and walk each day?
Yeah, definitely for the past few days.
It has.
I usually go on a walk every morning before school, but I've been avoiding that.
Okay. And you didn't have any trauma to this at all? You're just lifting that bag of mulch?
Yeah.
Any neck pain?
Mm-mm.
You said no fever.
No.
Any chills?
No.
A rash?
No.
No. Alright. So you said, how old did you say when you had your first period?
14.
You were 14. And have they been regular?
Yeah. It
Yeah.
was.
Alright. How frequent are your periods?
They're usually around every 4 weeks.
They're-
Once a month, yeah.
Okay. And you said they last like 3 to 4 days normally? Alright. Any bleeding in between your periods?
No.
No. Any bleeding after having sex?
No.
No. Any pain with your periods at all?
Yeah, just like cramping.
Cramping? Is that normal for you?
Yes.
That's any vaginal discharge at all?
No.
Any itching?
No.
Sores?
No.
Or lumps?
No.
So I'm just going to ask you a little bit now about your history and your family history, if that's
Okay.
okay. All right. So you said that you were only hospitalized for your children.
Mm-hmm.
Do you remember when they were?
96, 1996, 93, and 98.
98. Do you remember what hospital this took place in?
Penn.
Penn?
All
And any complications that came from these at all?
No.
No. Any surgeries at all?
Well, 2 of them were cesarean.
2 were cesarean?
Yeah.
Which 2?
The last 2.
Last 2? And any complications from those? Alright. Have you gotten your flu shot this year?
Yes.
Yes, you have. Alright. Hepatitis B?
Yeah.
Your chicken pox vaccine?
Mm-hmm.
Pneumonia?
Mm-hmm.
Have you had a mammogram recently?
Yes.
Yeah? When was the last one that you had one?
Oh, I can't remember. Probably like 5 months ago.
5 months ago?
Yeah.
Did they find anything?
Nope.
Right. Have you ever had a colonoscopy?
No.
Right. Pap smear?
Yes.
And when was your last one?
7 months ago.
7 months? Any findings with that?
No.
No. Right. Have you ever had a TB test done?
Yes.
Yeah? And how did that come back?
Negative.
Negative. Have you ever had your cholesterol checked at all?
No.
No? And have you ever had a blood stool test done?
Yes.
And how did that come back?
It was fine.
It's fine? Alright. So can you tell me a little bit about like your parents and grandparents, like how old they are, any medical?
Well, my grandparents are deceased. My father is 72 and my mother is 68. And they're both very healthy.
They don't have any medical conditions at all?
My father is pre-diabetic.
Pre-diabetic?
Yeah.
And do you know anything about your grandparents at all?
I know that my dad's parents had high blood pressure.
They both did?
Yes.
And he doesn't have it?
No.
And it seems like you don't have it either, based off previous. Anything with your mother or
No.
your mother's parents?
No.
No? Any siblings?
I have one sister.
One sister, and how old is she?
52.
52? Any medical conditions with her?
Yep.
No? You have 3 children? Any grandchildren? No. And do your children have any medical conditions yet?
No.
No? Alright. Have you been experiencing any headaches?
No.
No? Do you have a history in your family of any seizure disorders?
No.
Stroke?
No.
Any mental illness?
No.
Suicide?
No.
Substance abuse?
No.
Thyroid disease?
No.
Coronary artery disease?
No.
Hypertension you said was in your
Father's
father's side?
Yeah.
Any elevated cholesterol levels?
Not that I know.
No. You said your dad is also pre-diabetic?
Yes.
Have you been checked for that?
Yes, I have.
And it's been okay? Alright, good. Any asthma or lung disease that
No.
runs in the family? Tuberculosis?
No.
Renal disease?
No.
Arthritis?
No.
Allergies?
Just my seasonal allergies, but that's it.
And any cancer
No.
at all? Nothing like that? Alright. I'm going to ask you a couple questions about like your social history.
Okay.
Do you remember where you were born?
In New York.
New York?
Mm-hmm.
Where in New York?
Long Island.
Okay, how would you describe your childhood?
It was great.
Good? What's your highest level of education?
I have a master's.
You have a master's? Master's in teaching. So yours doesn't have any exposure to any hazards at all?
No, just the occasional cold.
Okay. Yeah, those kids like to get sick sometimes. All right. Have you had any previous occupations at all?
No.
Now you've been a teacher.
Yeah.
A little bit about your home now. Do you live in an apartment, a house?
We live in a house.
In a house?
Mm-hmm.
And how many steps would you say is in your house?
We only have one flight, about 15 steps probably.
About 15 steps. Does it hurt to go up those stairs?
No.
No?
Just recently.
Just recently?
But besides that, no.
Okay. And how many people live in your home?
3.
3?
Yes. Well, 3 other than me.
3 other than you?
Yeah.
Okay.
So me, my husband, and 2 of my children. One of them is out of college.
One's off of college?
Yes.
All right. And you're related to all of them. Do you feel safe at home?
Yes.
Yes? And do you have any pets?
Oh, we have 2 dogs.
2 dogs? What kind?
A golden retriever and a black lab.
Oh, that's nice. Do you have any allergies to them at all or anybody? Okay, good. Do you have any stressors in your life, like work or?
Well, work gets stressful occasionally, but nothing like significant.
Okay. Have you ever been in the military?
No.
And how would you describe your financial situation?
Good.
Good?
Yeah.
Mm-hmm. What do you like to do in your free time?
I like to garden. Yeah, me and my husband are big gardeners. Do outdoorsy things like hike, go to the beach, things like that.
Beach?
Mm-hmm.
Yeah, I love going to the beach in the summer. All right, your support systems. Family, friends, religious affiliations?
It's mostly family and friends.
Family and friends.
Mm-hmm.
All right, your sleeping habits. Can you describe them to me?
Yeah, I usually sleep around 8 to 9 hours a night.
8 to 9 hours a night? And do you sleep through the night? And do you have any issues like with any daily activities, like getting dressed with your injury or anything like that?
No, nothing like that. Just like walking.
Just walking really is really hard for you right now.
Bending down like to lift heavy things is a little difficult as well.
How about doing laundry?
I haven't done laundry.
You haven't done laundry since then?
This, yeah.
Okay.
But I'm sure it would be a little bit more difficult.
Okay. Do you have any food restrictions at all?
No.
No. All right. Walk me through a normal, day of meals that you have.
Well, in the morning I usually have either oatmeal or like a smoothie. At lunch it's usually like a salad or a sandwich or something. And then we like to cook dinner together at night, which is usually like something with like chicken or sometimes we grill out back.
All right. Sounds pretty good.
Mm-hmm.
How much do you get to drink each day, water-wise?
Well, I have a 32 ounce and I try to drink 2 of those.
Try to drink 2 32s a day?
Yes.
All right. And caffeine?
I do drink a lot of coffee.
How many cups a
usually
day?
2 cups a day.
2 a
I'm
day?
trying to cut down.
Trying to cut down. All right. Do you consume any alcohol?
Occasionally a glass of wine.
Okay. Occasionally a glass of wine. And what type of container do you drink out of?
Just a wine glass.
Just a wine glass.
Mm-hmm.
And what type of setting do you like to drink in?
Usually at dinner.
At
or
dinner?
Like if we go out to eat or something.
Okay. Do you currently smoke or use any type of tobacco? No. Do you exercise?
Yes.
And what type of exercise do you do, and how often?
I usually go on a walk every morning.
Walk every morning?
30 minutes, 40 minutes.
All right. So you haven't been able to do that since you got hurt?
Yeah, no, I've kind of just avoided it. It's been a little painful.
Right. Do you wear a seatbelt when you're
Yes.
driving and when you're in a car?
Yes.
Do you wear a helmet if you bicycle?
Yes, I don't very frequently bicycle, but if I would, I do.
All right. Any sunblock that you wear?
Yes.
Yeah. All right. Good. Do you lock your medicine cabinet?
No.
No. And do you lock any chemicals such as like household cleaners anywhere, like in a closet or cabinet?
Well, we have it in our pantry, but
In your pantry, is that locked or no? No. All right. I'm going to go back to your childhood illnesses now and try to get a nice rounded note.